I quit doing this 10 years ago. And
You quit doing dentistry 10 years
yeah,
ago.
I quit doing general dentistry 10 years ago. And I didn't really think I was stressed. I was probably like the average dentist working. And I have to say, it took me several months before I actually started to unwind. I didn't know how stressed I was. And this is very rewarding. It's more of a mental exercise. You're not bending over, drilling on teeth all day and those types of things. And Guy, of course, has come up with his top 10 reasons.
I want to say, first of all, Rich is one of the least stressed people I know, and the Bass of Texas are much more stressed because of it. But that's a that's another story. I do enjoy doing this. I always liked the David Letterman, and I came up with the top 10 reasons why I think any dentist would like to begin in dental sleep medicine. So we'll go through them here. Number 10, it's physically non-demanding. When I do the lectures and seminars, I'll show a picture of my wife standing on my back, and that's just not a made-up picture, even though I try to exercise and go to the gym and stay in shape. It's a physically hard job. Your back's hurt, your arms hurt. It's physically tiring, and dental sleep is not. You get to develop relationships with medical professionals. I have a whole group of friends that I wouldn't have who I've met through cooperative meetings and interaction with patients that I get to hang out with now. The cost is very minimal. I started my satellite office in a cardiologist office now. I don't have plumbing. I don't have all the stuff that you need. You can get started in this for very little. Right out of school, you don't have to have all the plumbing and everything that you need and expensive A-deck chairs. There's no anesthesia. I hate giving shots. I've never quite enjoyed that. Number 8, I'm sorry, I guess number 6. Sorry, I went backwards. No blood. I only blood I usually cause in my office is inadvertent, and I try not to see any. Not something I really enjoyed. And number 5, changing and saving people's lives. And these aren't necessarily in order of what's most important or most outstanding about doing this. You can change people's lives more profoundly in shorter period of time than you could ever possibly change a person's life with dentistry. I don't care if they're a dental cripple and you do implants and they spend $70,000 and you turn them into the Crest Smile person. You'll change that person's life, but you get the guy that comes up and hugs you and was about to die and prevented a heart attack and can go to work now, and all the stories you get. Rich, you agree? I mean, just think of the stories that you can recall. You literally profoundly affect people's lives. You can increase your revenues. My accountant said I'm the only dentist that he knows his revenues have gone up dramatically last year and the previous years before. And that's in a down economy when our restorative practice has decreased. If the economy has hit you like it has us in Florida, and you want to put a new revenue stream in, there's not a better way to do it in dentistry for less money. It's not technical or stressful. You get involved in dentistry and you do big cases because they're fun, you think, and then they turn into stress-oriented dentistry. We don't have that. The patients appreciate you. You get cookies and letters and so forth. I do think this probably is the number one reason and that I like it is no annoying emergency after-hours calls. I've had 3 calls about the last 10 years. When my phone goes off and it has the office ring, I can pretty much be assured it's not a dental sleep patient. Hope you get involved. That's 10 reasons at least why I think you should.
Thanks, Guy. I like that. And I can't stress enough the number 5 there, where you're really changing people's lives. They get off medications, they get off antidepressants. And I'm not talking about a guy comes in one day and the next day he's cured for life. I have patients that have been in devices for 10 years now, for a decade, and they're not the same people. They're just not. They're better off. I hear often, hey, it's good to have my wife back. It's good to have my husband back. We basically have touched on a lot of things tonight. We want to dangle that carrot out there and talk about what we have to do next in our webinar series. And certainly we hope that you will attend the others that we're putting on with Keller. Keller's done such a great job of putting this whole thing together. But where else can we learn more besides just these webinars?
We have on the screen a few references for you to check out. The first book's the one I've alluded to at least once. You can get that at the American Academy of Dental Sleep Medicine. And I think it's really a great book, a very easy read. I think it's a good book to share for sleep physicians too. The chapter 4 about comparing CPAP to dental devices is, I think, very important.
And the Principles and Practice of Sleep Medicine. It's a textbook that I think weighs about 40 pounds or something like that.
I took it with me when I was studying for my diplomate. I read all 1,500 pages, and I took it to Mexico. And with the weight restrictions these days, I couldn't put much else in my suitcase. But it's actually a pretty easy book to read.
It is. I've read a lot of textbooks in my life, as most dentists have. And I have to say, I think it's probably the best written textbook I've ever read. So it's worth a couple $100 that you invest in it. And it's certainly something that you can read chapter by chapter. And, a patient comes in and they have restless leg syndrome. And you pick that textbook up and in 30 minutes or 45 minutes, you know an awful lot about it. Certainly, we want you to commit to learning more about this. You've been teased with this tonight, and we hope that you will take the bait and you will start learning more about this. We hope that you'll start the journey down that road towards learning more.